Good afternoon, everyone. Thank you for joining us here at the National Health Insurance Authority for our monthly beneficiary educational session. This afternoon, we would like to take this time to welcome everyone that would have taken the time out of their schedule to log on to the call with us. We also want to encourage you to share the link as well as the flyer so that other persons can join and be informed of our topic for this afternoon. This afternoon, our session will speak to the topic electronic health records and your health. Here at the National Health Insurance Authority, our vision statement is to lead the way in providing access to affordable quality health care that Bahamians deserve. Our mission statement is that we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision that we make. Our core values, they speak to who we are. We are passionate, we are progressive, we thrive on partnerships, we operate with integrity, and we honor our beneficiaries by providing care and respect in all aspects of our services. Our focus here at the National Health Insurance Bahamas, in particular our wellness program, we are passionate and dedicated to creating healthier communities. And we've created a platform where our beneficiaries and the public at large are educated and encouraged on adopting healthy lifestyles. And we promote this by the adoption of 3 principles: incorporating exercise and physical activity into your daily routine. Our beneficiaries, it's important for them to understand that food should be their medicine and to focus on their mental, emotional, and their spiritual health. Here's where we are now as it relates to the National Health Insurance Bahamas program, where we are making a difference. Since our inception in 2017, we have led the way in providing access to affordable, quality healthcare that Bahamians deserve. And we would like to speak on 5 areas as to where we are making a difference. Our enrollment growth, we continue to offer primary care coverage to over 160,000 plus Bahamian citizens and residents. And they've all enrolled into our program, and we call them our beneficiaries. Our demographics is very diverse. Currently, the NHI Bahamas enrolls Bahamians from more than 17 islands. And this includes 7,000 plus Bahamians under the age of 5, and more than 30,000 school-age children, and they make up our pediatric population, and over 19,000 plus Bahamians and beneficiaries over the age of 65. And so we call this population our precious pearls. 96% of our beneficiaries who are enrolled in the program has revealed to us that they are satisfied with the services that they are receiving from the program. Our provider network is very expansive, and we can currently boast that there are 145 physicians attached to a part of our provider network from 89 primary care facilities. And these physicians and facilities stretch across 8 islands. We're also in partnership with 9 major labs across 16 locations. Our healthcare platform is also digitally enabled. And so our beneficiaries are able to receive their information that is documented via an electronic health record platform. And through this platform, the telehealth feature is also enabled for applicable visits. Due to this digitally enabled care, we saw it very important to educate our beneficiaries as well as the public on the topic, electronic health records and your health. This afternoon, our EHR specialist in the person of Ms. Tiffany Schron, attached to the National Health Insurance Authority, will present and speak to us on EHR, electronic health records. Tiffany Schron's journey into the realm of healthcare technology, particularly in electronic health records, is impressive. Her upbringing in a family that valued education and community service laid a solid foundation for her to pursue her passions. Her Bachelor of Science degree in Health Promotion from Dalhousie University provided her with the necessary knowledge and skills. It was during her internship at a major clinic where she was first introduced to the electronic health record systems. This exposure ignited her interest in health informatics, leading her to specialize in EHR management. Being one of the first EHR specialists in the Bahamas speaks volumes about Tiffany's dedication and foresight. Over the past 5 years, she has actively worked with various healthcare providers to implement and optimize EHR systems, aiming to improve operational efficiencies and ultimately enhance patient care. Beyond her professional endeavors, Tiffany finds joy in traveling, taking walks, and practicing self-care, which are essential for maintaining a healthy work-life balance. Her involvement in community service activities, particularly with her sorority, Alpha Kappa Alpha Sorority Incorporated, highlights her commitment to giving back and staying connected to her roots. Tiffany's gratitude for the opportunities and challenges that have shaped her career reflects her resiliency and positive outlook. With a passion for innovation and contribution to the ever-evolving field of healthcare technology, she is poised to continue making a significant impact in the years to come. This afternoon, I would like to welcome Ms. Tiffany Strawn as she speaks to us on electronic health records and your health. For those of you that are on the call, whether you're logging in via Zoom or you're tuning in live on Facebook, at the end of our presentation, we will welcome questions for Ms. Strawn. And we ask that you place your questions in the chat feature in Zoom as well as via Facebook. Ms. Strawn, welcome, and you are on.
Good afternoon, everyone. Chandra, thank you so much for that introduction. Okay, so we could actually go right ahead and get started. Today, we'll be talking about what is the patient portal and Hilo app. Let's go through the agenda. So first, we'll be going over what is the Healow app and the patient portal, how we can access it, what are the benefits, and then there will be 2 demonstrations. One logging in through the Healow app, which is done on a mobile device, and then the second one that will be done from a laptop or a desktop for the patient portal. And then lastly will be the questions. So what is the patient portal and Hilo app? So the patient portal and Hilo, which stands for Health and Online Wellness App, is a web-based communication module that is designed to facilitate communication between a practice and its patients to improve the quality of care. It enables patients to communicate with their practice easily, safely, and securely using the internet anywhere on any device. It gives patients 24/7 access to send messages to their providers, lab results, their visit summary, medications. They can view past as well as upcoming appointments and educational materials. Accessing the Hilo app and patient portal. Now, you may say, I'm an NHI registered beneficiary and I've never had access to the patient portal. How can I? So, the patient portal is a secured web-based portal that can be accessed from a laptop or desktop via the link sent from the practice. The Hilo app is an extension of the patient portal that can be accessed on any mobile device. This app can be downloaded for free from your Play Store for Android or App Store for iPhone. Now, the example that I like to give is comparing it to online banking. So, with online banking, you can access your account information via the link on a desktop, and then you can also access your account information from the app on a mobile device. So it works the same with the patient portal and the Hilo app. And this access is 24/7. So what are the benefits of this portal? The patient portal has been designed with accessibility and exclusivity in mind to better the experiences for all users. So first, it's safe and secure. Secure messages through the portal allow patients to communicate with their providers efficiently, reducing the need for phone calls and in-person visits for minor issues. Second, better patient engagement. Access to their health information encourages patients to participate actively in their healthcare, leading to better adherence to treatment plans and healthier lifestyles. Third, quality of care. The patient portal creates a convenient environment for patients to stay informed and be proactive about their health. Fourth, improved communication. Patients can communicate directly with their healthcare providers through secure messaging, asking questions and getting timely responses. Reduce burdens. So patients can view medications, access their test results, and this would also reduce the number of calls to the facility so that the administrative staff doesn't have additional work. And lastly, it promotes better patient outcomes. So patient portals improve outcomes with better care coordination, patient education, and patient provider communication. This increases access to information is essential to achieving better outcomes. So next, we will have a live demo of how you would log into the Healow app and different features that the Healow app has to offer. Today, we'll be demonstrating the Healow app. Hilo, which stands for Health and Online Wellness, is a health IT platform that gives patients 24/7 secure access to their visit summary, lab results, past and upcoming appointments, messages, medications, and patient education materials. The Hilo app can be downloaded from the Play Store for Androids and from the App Store for iPhones and iPads. Let's navigate to the app. Select Get Started. The Terms of Use agreement will appear. Once you have read this agreement, select I agree to the terms and conditions. Now let's get started. First-time users will have to enter their first name, last name, and date of birth. Next, it will ask if you have a practice code. You always want to select this option. The code can be found at the bottom of the initial email you received from the practice. If you are unable to find the email with the practice code, you can contact the facility and they can provide you with the code. You will confirm that this is your practice by selecting This is my practice. The account verification screen will display to access your account. We always advise using the email option. Click Next. You can check your email for the code and enter the 6-digit number. It will then prompt you to create a 6-digit PIN for security purposes. This PIN will have to be entered every time you open the Hilo app. Once entered, verify the PIN and then you're in. You can also add family members that are NHI registered to your account to access their record. You can add the family members by selecting the plus sign beside your initials, add new account, select the relationship, hit save. From there, you will select the practice code tab on the right and enter the practice code and click search. Please note, this is the practice code of the facility the dependent is registered to and not your practice. Once you select the facility, it will prompt you to create a username and password for your family member. Please be advised that the facility must set a username for your family member at the facility they are registered to prior to adding them. Once you receive the username from the practice, you will type it in and select Forgot Password. It will then prompt you to enter the details of your family member, including their first name, last name, and date of birth. Then select Next. The account verification screen will open to access your family member's account. Again, we always suggest using the email option. Enter the 6-digit code from your email. Now it will prompt you to create a new password and confirm that password. The password requirements are located at the top of the screen. Once completed, it will take you back to the login screen where you will enter the username and password that you just set and select Login. This message will appear and you can select I accept. To view all dependents, click the circle in the top left-hand corner to display everyone on the account. If you select the circle at the top right of the screen, it will change your home screen view. Visit summaries are available after the provider has completed the progress note for that visit. From the main screen, tap the Access Your Health Records tile. Tap the Appointments tile. Then tap an appointment in the Past Appointments and Visit Summary section. Tap the Visit Summary button. Swipe or scroll through the visit summary to see the details. Tap the Download button at the top right to download XML or PDF to export the visit summary. To view your lab results, tap the Results tile. You can filter your results by result date, test date, or test name. Click View to show details of the test result. You can personalize your account by adding a profile photo. Tap your profile icon, then tap the Manage Accounts button. Tap the camera icon next to your name. Tap Photo Library to select a profile photo saved to your device or camera to capture a new photo. Once you select your photo, feel free to make adjustments and then you're done. That's it for today's video and thank you for watching. Today, All right, so that was the Healow app demonstration. Now we're gonna get into the patient portal demonstration, which would be done from clicking on the link that would have been sent to your email from the practice. Good day, all. Today, we'll be demonstrating the patient portal. The patient portal is a secure, convenient, and easy way to access your health information via the internet. Patients are able to access their visit summary, lab results, past and upcoming appointments, messages, medications, and patient education materials all via the patient portal. The patient portal can be accessed by clicking on the link at the bottom of the email that you would have received from the practice. Please note here that the user ID is the email address. So I'm going to go ahead and select the link. It's then going to bring me to this welcome page where I can enter my user credentials. Enter your username, which will be my email. And then select Trouble Logging In. Once selected, you'll have the option of selecting the Forgot Username or the Forgot Password radio button, and you're going to select the Forgot Password radio button and enter your username once again. Again, the username is the same user ID that was displayed from the email, which is just my email address. Once I put in my email address, I'm going to select Submit. Next, I'm going to enter the 5-digit CAPTCHA that is shown on the screen, and then I'll select Submit again. Once that's done, it's going to send me an email letting me know that I can reset my password, and so I'm just going to wait for that email to come through. Now on my screen, it's displaying the email that I got with my password retrieval help. So it's just telling me that I can click on this link to reset my password. So I'm just going to click on that. It's then going to open up a new tab in Chrome. And then I'm going to type in my username again, which is my email address. Once that's complete, I'm going to go ahead and select submit. The user validation screen is now going to appear. We always recommend using the email option so that you can get the code sent to you via email. Click Send Code. You can check your email for the code and then enter the 6-digit number and then select Verify. Open up on my screen now. I have the email with the 6-digit verification code. So I'm just going to copy this and put this in here. And then I'm going to select Verify. Once that's done, it will prompt me to reset my password. So I will start to enter a password in. And if you notice, there are password requirements that will help you to create a strong password. If not, you can always click on the password guidelines button and it's going to show you exactly what ECW recommends being a strong password. Once that's complete, you would select Next. And now you are in the patient portal. So on the home screen, which is this screen that we're looking at here, you can see your messages. So whether you had any messages between you and your provider, you would be able to see them here. You can see your lab results here. You can click View All. And it's going to show you the name of the lab and the results. I'm just going to click back on Home. Then we have a tile that's called Patient Education. So had your provider sent you any educational materials, they would be right here at the bottom for you to access. Now, there are a few differences between the patient portal and the Hilo app in terms of what you can do. So the first thing you can do from the patient portal is update your personal information, such as your address, marital status, gender, and contact details. To do this, you will select My Account at the top left, and then you will select Personal Information. And this is where you'd be able to update the info by clicking the blue Update Info button at the top right. And then it will allow you to put all of this information in, including your email address. So you are able to update your email as well. From the previous video, you would have seen that you had the ability to add family members as well as update your profile photo via the Hilo app. Unfortunately, those two features can only be done on the Hilo app and not the patient portal. That's it for today's video. Thank you so much for watching. All right, so that was the demonstration for the patient portal. I see we have some questions coming in, but we'll save those until the end. Now, I know that that may have been a lot of information for you to follow. So we at NHI will ensure that these videos are on the website so that you can always refer back to the website in the event that you need help logging into either the patient portal or the Hilo app. So overall, patient portals enhance the health experience by promoting efficiency, engagement, and empowerment, benefiting both the patients and the providers. Thank you so much. Chandra, I'll turn it back over to you.
All right, thank you again, Tiffany, for taking us through the portal, what it looks like, how we can access it, and how we can definitely create our accounts and be able to access our health records in an electronic platform. We did receive a few questions, Tiffany, that's coming through the chat, and I'll read them to you. I'll read the first one. The first one says, how and when will my healthcare facility send me a passcode?
Okay, so from the facility side, they have to physically go in, and from your demographic screen, when they're putting in your information, they will web enable you. So once you are web enabled, you will receive an email from the practice, and it's going to say welcome to the portal. It's going to tell you that you have the ability to sign up. So let's say, for example, you were registered when NHI initially started, which would have been in 2017, and you are now unable to locate that initial email. You can just call your facility, let them know that you joined the session and you were interested in signing up for the portal, and they would be able from their side to resend you a link that you would be able to click so that you can access and set up your portal.
All right. Thank you, Tiffany. So the second question says, was there a meeting held prior to this session today for physicians that are a part of the NHI network to inform them that this option is being offered to their patients? I'm guessing, Tiffany, that we can speak to that to the element of the electronic health records and digitally enabled care from both sides, from a beneficiary perspective as well as a provider perspective.
Okay, so the question is if a meeting was had prior to, as if like beneficiaries and providers know that this exists, essentially?
Correct. If I guess both sides of the party, if providers know it exists and if our beneficiaries know it exists.
Okay, so I'll speak from the provider side. So yes, the providers and the staff, they know once we do their initial training on the electronic health records system that they use, we inform them, we show them how to web enable the beneficiaries so that they are able to let their beneficiaries be able to sign up for the portal. And we do trainings on that for them from their side. Now, they have been sent some documentation recently as we had an uptick in beneficiaries who were interested in being a part of or logging into their patient portal and Hilo app. And so they would have just gotten some information, I believe it was earlier this week, regarding that. Now, for the beneficiaries, we did have a beneficiary educational session. I believe it was 2 years ago. But I'm not sure. I guess someone from the benefits team would be able to speak more to if something was done for them recently.
And so after the session this afternoon, Tiffany, thanks for speaking and answering that question. After the session this afternoon, these videos will be posted on our social media channels so that members of the public, whether you're a beneficiary, providers, the public at large, will be able to go back and rewatch the tutorials and be able to access the electronic health records. And then also create your portal so that you can access your electronic health records. The third question, Tiffany, what security measures is NHI offering to patients for family members adding them on the portal without their permission? Will the patient have the option of giving the permission, as this information is sensitive outside of parents having their children information?
Okay, that is a good question. So from the EHR, when the facility is giving you the access to this portal, they do have an option to give you complete access to your family member or restricted access. So I guess in the case, like let's say, for example, I had a disabled parent and I wanted their access. If my parent, obviously my parent would be over the age of 18, so they would be able to specify whether or not they want my access to be restricted or if I can see everything. So they do have restricted and complete access, but that is a really good question.
Yeah, it is definitely a good question because we have adults managing accounts for their adult parents, all right? And so having that confidentiality is also very important. This fourth question, will notes and labs be available for review after the doctor approves, or is the information readily available?
Okay, so the information that the beneficiaries can see on their portal can only be seen once a provider has completed all of the documentation and their note is locked. So the beneficiary won't be able to see anything prior to having that note locked.
Understood. So thank you for pointing that out to us. Because there's also a follow-up question, and so it also goes hand in hand. The question speaks if the results are critical and the patient, what happens when there are critical results and the patient views the labs prior to the doctor seeing them? Is that the same instance for a lab report or a lab result?
So again, very good question. So what we actually are in the process of doing right now, the EHR team, we are marking certain labs as confidential. So because we have the EHR now and we do have the lab interface set up where once the providers order their labs through the EHR system, the labs, when they send the lab results back, it goes directly into the EHR system, and then it would essentially go to the patient portal if the patient is signed up for the portal. But what we went ahead and we did was we marked all of the labs underneath the STD panel, as well as the HIV. So those sensitive labs, we marked those as confidential. But we did reach out to the facilities to let them know that if they want additional lab tests to be marked as confidential, they can go in and they can do it. And we showed them the steps on how they can have this done.
So so after I would have had the conversation with provider on a confidential results, and if I now want access to that moving forward, he would be able to unlock it for me.
That is correct. So essentially, let's say, for example, I have my annual physical done and my HIV results come back positive. Instead of that result coming directly to me, my provider is going to reach out to me, have maybe a televisit, or we have a follow-up visit in person. They're going to let me know these results in person. And then once we discuss those results, then I would be able to see those reflected on my portal.
Okay, thank you. Thank you for that. So Miss Strawn, I see that Miss Sabrina Sweeting, who is the team lead for the EHR specialist, she's also on the call this afternoon, and I see that she's also very interactive in responding to questions that are placed in the chat. So for those individuals who may be driving and are not paying attention to the chat, I'm still going to read the question for you, Tiffany. So the question is from a provider. As a provider, if the patient were to message us through the app or the website, where would we go to receive the response?
Do I answer this one or did she answer it? Sorry.
She did answer, but in the case if persons are driving and they're not able to access the chat, can you speak to that response?
Yes. Okay.
I noticed that we have a few providers as well as some laboratory personnel and pharmacy personnel on the call. Yes.
Okay, yes. So essentially, if a beneficiary sends a message from their portal, from the provider standpoint, from their EHR system, we have jelly beans at the top of the screen. So the one that they would choose is the T jelly bean. And then they would click on the web encounters, and then they would be able to view those messages from there and then respond from there as well.
All right, thank you. So she did make that reference. All right, I think a few of the questions are occurring at this point. So Tiffany, I'm able to access my records on my Hilo app, on my device, on my handheld device, on my computer. If I will happen to be referred to a specialist from my primary care physician, am I able to print my records from the app or from the portal?
Yeah, so you would be able to. So from the Hilo app demo video that was there, you would notice when I clicked on visit summary, there was a download button at the top right-hand corner of the screen, and it would allow you to download that summary or those results in PDF or XML, I believe the format is. But yes, that is possible to do.
Okay, understood. Thank you for that. So I think we would have covered most of our questions that we'll place in the chat. If there are any remaining questions, if anything was left untouched, please feel free to place your questions in the chat. I would also like to reiterate that we will be posting the tutorials that were shared this afternoon on the call on our social media platforms on Facebook, as well as Instagram. And so please feel free to visit our social media platforms later this afternoon to receive the tutorials. As always, you're also able to reach out to us, and later on in the presentation, we'll post our contact information, because I've seen that persons are also asking questions on how, if this is not practice, who do we contact at NHI? Definitely you can reach out to our benefits team, and they would assist you with acquiring your information that is through the electronic health records platform. So Tiffany, a question just came through. Is a provider able to resend a link? So if they send me the first link and it expired, what is a provider able to resend me or reactivate the link so that I can download and access my records?
Yes, that is correct. They are able to. So they would essentially go into the patient demographics. And at the bottom of the patient demographics screen, there are a few buttons. The third one from the left being options. When they click on that, there is going to be a few options that you can select, but the one that the provider or the front office staff would select is web enable. And then that screen is going to open up. And then essentially what they can do is select the blue reset button. I think it's blue. If it's not blue, it's gray. But what that would do is it would send you a link, and it would allow you to be able to reset your password for the portal. And it would have the user ID as well. So whether they may have changed the username to your actual name or whether they kept the username as your email address, that will also be in the email. So that is how they can do that.
All right, thank you so much, Tiffany. And so we don't have any more questions for Ms. Strawn this afternoon and for our EHR specialist team. I think I saw Ms. Sweden. She also placed the same information in the chat feature, so persons are able to follow it. If we don't have any more questions for Ms. Tiffany this afternoon, we would like to release Lady Tiffany. And at this time, I'd like to turn over the floor to Mrs. Cece LaFleur with our vote of thanks. All right, everyone. My apologies for the brief intermission, but Mrs. Cece LaFleur, she is coming on now with our vote of thanks for this afternoon.
Oh, here I am. All right. Thank you so much. My apologies for the delay. I wasn't able to access. First of all, thank you so very much for all of you who have dialed in today. You've been very supportive of these beneficiary education sessions, and we certainly hope that this one proved to also be informative and educational. And especially to Ms. Tiffany Strawn. Tiffany was one of the first two electronic health specialists that we had here, not only at the National Health Insurance Authority, but here within the country. We now have a total of 5, and what they do is certainly integral to the interactions we have primarily with our providers and those in the wider community. So Tiffany, thank you ever so much for imparting this knowledge here within, not only internally for those that have dialed on, but more importantly for those externally who dialed on. And once again, we certainly hope that it has been helpful to all of you. So thank you ever so much for participating. And Tiffany, thank you once again, one of our first electronic health specialists in the country, and keep doing what you do. You're doing a great job. Thank you.
All right. Thank you, Mrs. LaFleur. Thank you, Tiffany. And so we before we conclude our call this afternoon, There are some things that we have in store for our beneficiaries and the public at large from a wellness perspective here at NHI. And once per month, you have an opportunity to move, learn, as well as eat healthy with us. And so we encourage you to join us again next month for our beneficiary educational session. Feel free to log on to our social media platforms, check your emails for more information. Next month, on the fourth Thursday of the month, we'll be hosting our Power Hour session, and it's a step aerobics class with Coach Clee. So stay tuned to our social media platforms again for more information. And then our monthly farmers market is held on the fourth Thursday of the month. And so you're able to have lunch with us, purchase some healthy produce, support some local vendors, as well as participate in our chair massages at a very, very minimal rate. And so if you need further information, we welcome you to contact us for more information on NHI Bahamas. And if we can be of any assistance to our beneficiaries, if you're interested in enrolling a family member, if you're having issues with accessing your electronic health records platform, we welcome you to contact us via email at info@nhibahamas.gov.bs, via telephone at 396-8500, via our social media platforms on Facebook, Instagram, LinkedIn, as well as Twitter. And we have a newly added contact, our WhatsApp line. And so you can WhatsApp us throughout the day at 813-2801. We are very responsive, we are very active, and we will answer your questions in a timely manner. And then you can also log into our website at www.nhibahamas.gov.bs. Thank you so much for your time this afternoon. Thank you so much for your engagement. Thank you for your questions. And we look forward to you joining us next month for another installment of our beneficiary educational session. Have a great Thursday and a wonderful weekend. Goodbye, everyone.